In this video, we show you what to expect when having a basal cell cancer removed from the forehead using a Mohs surgical technique. This cancer is extremely common, impacting millions of people yearly, so stick around and be informed. Welcome to HEALTHdrum. I'm Dr. Bert Vorstman, a urological surgeon, and this channel is all about routine medical conditions, self-care, and cash pay healthcare options so you can be in control of your healthcare needs. If this is your first time here and you want to learn about routine medical conditions, subscribe below and tap the bell so you can be first in line to get the very latest on healthcare management. We get contacted by patients, employers, and providers regularly looking for ways to ease their healthcare burdens. So reach out, send us an email, or hit the comment section below. So let's get into it. Here's a summary of what you will see. Site preparation, local anesthetic, cancer excision, and wound closure. But before we move on, we need to address the disclaimer. This channel is for educational and informational purposes only, and you should consult your personal physician for medical advice, diagnosis, and treatment. Now you can pause the video and read the disclaimer at your leisure so you fully understand it. So what is Mohs surgery? I've summarized it here in this next table. Mohs surgery is a surgical technique used to remove skin cancer. After removal, the specimen is examined microscopically. If cancer cells are seen at the edge of the specimen, more skin is removed adjacent to where the cancer cells were seen on the slide. This process is repeated till specimens show margins clear of cancer. Finally, the wound is closed and the patient goes home. Let's check the video now and see what happens during this office-based procedure. The patient has had the area biopsied previously to establish the diagnosis and now returns to have the complete cancer removed using the Mohs surgical technique. The area is gently swabbed with a disinfectant and the piece of skin to be removed is measured and marked out. Local anesthetic is injected. Once the area is numb, the tumor surface is scraped off. The cancer is then cut out. The wound is cauterized to stop bleeding. The specimen is taken to the adjacent lab and prepared for microscopic examination. And in this particular case, the specimen margins were clear of cancer, so no extra skin needed to be cut out. The wound was closed and then the patient discharged from office to return several days later for suture removal. Although fairly routine, every procedure has potential complications, and for this particular procedure, we've inserted a table so you can follow along. Wound bleeding, wound infection, wound separation or disruption, wound scarring, and recurrent cancer. Now, besides surgery, there are several other possible treatment options for basal cell skin cancer, but we will cover these at another time in other videos. This video showed you how basal cell skin cancer was removed from the forehead surgically using a Mohs technique. To learn about other medical conditions, check out these videos so you can be better informed and in control of your healthcare needs.